It was a cold February morning when the news broke, a piece of information that would change the lives of millions. The White House had just announced a groundbreaking $2.8 billion funding package aimed directly at Social Security and SSDI recipients. The timing couldn't have been more symbolic. On Valentine's Day, a day typically associated with love and affection, the government was delivering something even more valuable: financial relief for those who needed it most. For years, Social Security recipients had faced mounting challenges. Inflation continued to rise, the cost of healthcare showed no signs of slowing down, and everyday expenses put a strain on fixed incomes. Many had begun to wonder if any real help was on the way. Then, like a long-awaited answer, this historic initiative was unveiled. Unlike the broad stimulus packages of the past, this one was laser-focused on those who had been disproportionately affected by economic hardships: the elderly, the disabled, and those who relied on Social Security as their primary source of income. The announcement sparked immediate curiosity. Who was eligible? How much would they receive? How soon would the payments arrive? The executive orders signed into effect made it clear. This was not a one-size-fits-all approach. Instead, a tiered payment system was introduced, ensuring that those with the greatest financial struggles would receive the most assistance. The distribution process was also designed for efficiency, with the IRS working hand in hand with the Social Security Administration to ensure a seamless rollout. But as with any significant financial initiative, concerns arose. Could the government deliver on its promises without delays? Would the payments truly reach those who needed them the most? While some remained skeptical, others found hope in the structured, methodical approach laid out in the executive orders. The first payments were set to hit bank accounts as early as February 14th, with a phased distribution ensuring that everyone received their funds in a timely manner. As the days passed, recipients began to prepare, verifying their banking details, staying vigilant against potential scams, and keeping an eye on official government announcements, all necessary steps to ensure they received their rightful support. The program was designed to be as hassle-free as possible, with no additional applications or fees required. For many, it was a relief to know that they wouldn't have to jump through bureaucratic hoops to access their stimulus checks. The true impact of the initiative was felt not just on an individual level, but across entire communities. With more financial stability, recipients were able to pay their bills, afford necessary medical care, and contribute to their local economies. Small businesses, grocery stores, and service providers all felt the ripple effects as more money circulated. This wasn't just a short-term fix. It was a move that could potentially reshape the way financial aid was distributed to Social Security recipients in the future. As February 14th arrived, anticipation reached its peak. The first wave of payments rolled out, bringing much-needed relief to millions. Stories began to emerge of retirees who could finally afford their medications, of disabled individuals who could now access better care, and of families who felt a weight lifted off their shoulders. It was a moment of collective exhale, proof that timely and targeted government action could make a real difference. Looking ahead, experts predicted that this initiative could set a precedent. If successful, it might pave the way for future financial assistance programs, reinforcing the importance of supporting those on fixed incomes during times of economic uncertainty. The discussion surrounding Social Security reform gained new momentum, with policymakers and citizens alike weighing in on how to ensure long-term financial security for all recipients. In the following weeks, federal agencies worked tirelessly to manage the logistics of this massive disbursement. Reports emerged of how the Social Security Administration was increasing its customer service workforce, hiring additional representatives to handle the influx of inquiries. The IRS, too, launched a dedicated online portal, allowing recipients to track their payments in real time. These proactive steps aim to eliminate confusion and ensure a smooth rollout process. Meanwhile, financial advisors and experts across the country analyzed the potential economic impact of this stimulus package. Would it significantly boost consumer spending? Could it help mitigate some of the inflationary pressures that had made daily living costs unbearable for many? While opinions varied, there was a shared consensus that putting money directly into the hands of those who needed it most was a step in the right direction. One of the most unique aspects of this program was its consideration of regional cost of living variations. Unlike previous federal aid programs, which often distributed uniform amounts regardless of location, this initiative factored in geographic economic disparities. Recipients in high-cost states such as California and New York were set to receive slightly higher amounts than those in lower-cost areas. This move was widely praised as a more equitable approach to financial relief. Community organizations and senior advocacy groups also stepped in to ensure that beneficiaries fully understood the details of the program. Local Social Security offices hosted informational seminars, providing guidance on how to recognize scams and avoid fraudsters who often preyed on vulnerable populations during such disbursements. Senior centers collaborated with financial counselors to help individuals manage their newfound funds wisely, emphasizing the importance of budgeting and prioritizing essential expenses. As the weeks went on, the real-world effects of the initiative became even more apparent. Grocery store owners noted a slight uptick in sales. Medical clinics reported an increase in appointments as seniors sought long-delayed treatments, and utility companies saw fewer overdue bills. The additional financial security allowed many recipients to breathe a sigh of relief, knowing that they had some buffer against economic uncertainty. Yet, as with any government program, challenges arose. Some individuals reported delays in receiving their payments, prompting government agencies to double down on troubleshooting efforts. The IRS and SSA expanded their helpline capacities, working overtime to resolve issues as quickly as possible. Lawmakers also stepped in, pushing for transparency in the distribution process to maintain public confidence. As discussions about long-term support measures continued, some policymakers floated the idea of making such targeted relief a recurring initiative. Could this be the beginning of a more structured supplemental assistance program for Social Security recipients? While no formal proposals had been made, the success of this stimulus package undoubtedly sparked new conversations about the role of government aid in safeguarding financial stability for retirees and disabled individuals. Beyond financial relief, the initiative also spurred renewed advocacy for Social Security reform. Economic experts emphasized the need for sustainable funding solutions, while lawmakers debated strategies to ensure that benefits remain robust for future generations. The conversation extended to cost of living adjustments, healthcare accessibility, and potential expansions of existing support programs. As this historic financial initiative continues to unfold, staying informed is more important than ever. Subscribe now to receive the latest updates on Social Security, stimulus programs, and other critical financial developments. With so much at stake, you won't want to miss a single detail. Hit the notification bell and be the first to know how these changes affect you and your loved ones. The future of Social Security is evolving. Stay with us to navigate it together.